Bismillahirrahmanirrahim. Dear students, welcome you all to the Industrial Pharmacy course. Every class, recalling from the previous lecture in which we have studied the various equipment that is used for testing methods of the pharmaceutical suspension. So far we have completed two chapters. First chapter that we have completed, that is emulsion, in which we have studied the classes of pharmaceutical emulsion. I have also told you briefly about the pharmaceutical application of pharmaceutical emulsion. In classification, we have classified the pharmaceutical emulsion on various bases. In the first chapter, we have also discussed in detail the formulation as well as the equipment used for formulation of pharmaceutical emulsion. And finally, we have also studied in detail about the stability and the various symptoms of instability in the pharmaceutical emulsion. That was a brief overview about the first chapter that we have discussed in the first and second week. The second chapter that we have detailed discussion on that. So far in the previous lecture we have completed the second chapter entitled suspension. In suspension we have studied the introduction, classification of pharmaceutical suspension, pharmaceutical application of suspension, various equipment that is utilized in the manufacturing of pharmaceutical suspension. And in the previous lecture I have also told you about the last topic of pharmaceutical suspension chapter, that was the various equipments used and testing methods of pharmaceutical suspension. Dear students, our today topic is the third chapter, that is semi-solid dosage form. And this semi-solid dosage form, today we will discuss general introduction, of the semi-solid dosage form, including the ointments, paste, gels and jellies. We use this terminology and you heard this terminology and routine use pharmaceutical preparation. The main focus of this study is to learn about the semi-solid dosage form, and specifically the ointments, paste, gels and jellies. What are these? Some is semi-solid dosage form, including the ointment, paste, gels and jellies. Dear students, after the completion of this lecture, you will be able to learn about the definition of semi-solid dosage form, including the ointments, paste, gels and jellies. Before going to the discussion, first of all we will define that what is semi-solid dosage form. You know that dosage form is the physical state of the drug, and there are different types of dosage form, like the solid dosage form, liquid dosage form, and semi-solid dosage form. Depend upon the physical status or the physical status of the preparation. One of that pharmaceutical appearance is semi-solid dosage form, which are dermatological preparation intended to apply externally on the skin or mucous membrane to produce local or systemic effect. It is clear from the definition that it is the dermatological preparation. It is used for the skin and it is applied for the skin. External application is there, and the aim of this external application to the skin or mucous membrane is to produce the local effect, the locally therapeutic efficacy to achieve, or systemic effect. For example, ointments, paste, gels. These are the example of semi-solid dosage form. Now let's discuss what is ointment. Ointments are homogeneous, translucent, viscous, semi-solid preparation that is intended for external application to the skin or mucous membrane. In this definition, you can see that it is homogeneous, homogeneity, and the formulation is mandatory, and it is a translucent one, and viscosity of the formulation is also essential. In general, ointments are composed of fluid hydrocarbon. It is meshed in a matrix of higher melting solid hydrocarbon that having the high melting points, and most of the ointments are based on mineral oil and petrolatum. You can see that for most of the formulation, that is ointments formulation, that is comprised of the primary parts of the mineral oil is an ingredient, and petrolatum is also one of the ingredients. It is mostly included in the formulation of the ointments or in the formula of the ointments. Another semi-solid dosage form, that is termed as paste, which are basically ointments, but in this case, that is paste is that type of ointment into which a high percentage of insoluble solid, or in which the solid content has been added in much more quantity as compared to that is in the ointment. Or we can also define it as it is a semi-solid dosage form that having high amount of insoluble solid, and the range of that amount, it is high percentage of the insoluble solid, it is 20 to 50%, but remember that this range is the weight by weight percentage. It is from 20 to 50% if we have a formulation that is semi-solid, and the insoluble solid added to that one, that is in the range of the 20 to 50% weight by weight, and we will term that as paste. They are valuable. The importance of the paste: they are valuable as protective barriers on the skin. They provide a protective barrier to the skin if we apply to the skin, such as for treating diaper rash in the children. And paste are also used for protecting the face and lips from the sun. If we are experiencing some difficulty on the sunlight, fall on the face and lips, and there are certain consequences. To avoid this problem, we will apply the paste. The paste is a suitable gel for protecting the paste and labs from the sun as well. Another one that is termed as gels. This is also a semi-solid system, but here liquid phase is constrained with a 3D. 3D means three-dimensional polymeric matrix having a high degree of physical or chemical cross-linking. The polymeric matrix is a matrix containing a polymer that is a three-dimensional network and having a high degree of physical or chemical cross-linking or networking position. Examples are aluminum hydroxide and magnesium hydroxide gel. Remember that clays such as bentonite, aluminum magnesium silicate, that is also termed as V-gum, and to some extent choline form gels by flocculation in a special manner. To flocculate clays such as bentonite or aluminum magnesium silicate, and up to some extent choline, they will form gels. They are flocculated, but remember that they are flocculated and a certain SOPs or standard operating procedure is followed, and after that procedure they are flocculated, they are merged with one another, they will form gels. Let's come toward the differentiation between the paste and ointment. Paste contain large amount of finely powdered solids such as starch, zinc oxide, you have heard about the zinc oxide paste, and calcium carbonate. Whereas ointments contain medicaments which are generally dissolved, either it will be dissolved or it will be suspended or emulsified in the base. It is termed as ointment base, and with this particular medicament or API, that is active pharmaceutical ingredient, there are three conditions. Generally it will be either dissolved or it will be suspended or emulsified in the paste. Paste are less greasy, whereas ointments are more greasy. If we focus on the greasiness, we will find that paste are less greasy as compared to the ointments, which are more greasy as compared to the paste. Another semi-solid dosage form, it is termed as jellies. These are also transparent or translucent, but it is in this case these are non-greasy semi-solid dosage form. Compared to the gel, if we compare the greasiness of the jellies with the gel, we will find that jellies are less greasy compared with gel. Jellies are mainly employed for mucous membrane, but the purpose is for lubricating the mucous membrane. It may be also employed or used for antiseptic purpose as well. Jellies are also used for lubricating surgical gloves and catheters. Surgical gloves are a special procedure. Jellies are employed in order to lubricate the surgical gloves, and the surgical operations are where necessary. It is also used for the catheter in order to lubricate the catheter. It is used for the patient in the hospital. These are the references. The one reference is the Lackman, Laberman, that they were in practice of industrial pharmacy. Third edition that I have already uploaded for you on the university portal. Let's come toward the overview of the today lecture. Today lecture we have defined the semi-solid dosage form, and after that we have defined the several other dosage forms, semi-solid in nature, including ointment, paste, gels, and jellies. And I have told you the key points in the dosage form, which are called as semi-solid dosage form. The differences between the paste and ointments, and jellies and gel. Also, I have told you about the reference. Thank you all for your attention.